All right, turn it over to you.
Good morning, everybody. For those who came back for my first presentation, and thank you for coming back. For the newer people here, thank you for coming. My name is Jeff Weinberg, and I am the president of a business that I have, which is called Caregiver Champion. And what I do is that I'm a nationally certified healthcare patient advocate. And I've been in the field for over 25 years as an administrator, both in hospitals and in nursing homes. And I've planned and implemented almost all services dealing with geriatrics as well as dealing with people who have disabilities and need rehabilitation. I did write a book called The Emperor Needs New Clothes. The book is based basically on experiences that I've had and helping other people to navigate the healthcare maze. And it is on sale at Amazon or Barnes and Noble. Last week, we talked a little bit about how to be your own advocate, which is critically important. We talked about things that you needed to do, and basically the main thing was to not be shy, ask questions, and have someone with you to get involved with whatever it is that your questions are or care needs are. So today, you see it's an interesting title, Forgetfulness versus Dementia. And I'm going to start out by saying on my door, when I leave my home, I have a sticker that says wallet, keys, cell phone. Okay. And you know what? Even with the sticker, probably 1 out of 4 times I forget one of those. And I'm like, my wife goes, why aren't you reading your sticker? So I'm sure all of us who are old enough go through forgetting things. And then we go, I wonder if I'm getting dementia. And there's a big difference between the two. And that's what we're going to talk about today. And somebody mentioned before we started giving one of these tests that I passed out to Trump and Biden. And again, not to discuss politics, but I found an article that was about how age has become a huge issue for both of them, as well as anybody else who's getting older. And truthfully, and because I'm in the field, I really feel that's what we call ageism. People forget things as we get older, but that doesn't mean that they don't have the ability to do other things. And that's where I'll end that discussion. But as part of this article, they talked about elderly moments or forgetfulness. So you go out with your wife or your friend, you go to a restaurant, you meet somebody, and they're going, Jeff, so good to see you. And you're going, who is that person? Who is that person? Who is that person? So we just talked about this last week with another couple. So what we end up doing now is like if somebody does that and I don't introduce them to my wife goes, "Hi, I'm Dee Weinberg," and shakes her hand. Okay, and then that person introduces themselves. So it's a way to get around the embarrassment of saying, I really forgot your name. So, but we all have all of these issues dealing with, memory moments or lack of them, and we just can't pull something out of our head. We were watching television and I go, "Oh, this person's been on a lot of stuff." And then I go, what stuff have they been on? Now, it's like, thank God for Google. Because you can Google what and go, who's been on Mission Impossible and, what time, whatever. So we now have a resource at least that we can look for things that before it was just like, I just can't remember. And it's another senior moment, okay? And we all get them. Some of them get them earlier, some of them get them later. But senior moments, forgetfulness, all of those kinds of things are basically things that as we age, it happens to all of us. Okay? So the forgetfulness, as I said, is a normal part of aging. And like we talked about, it does not mean that you have dementia. So not all people with memory problems have dementia. And what we're going to talk about is what is the difference between forgetfulness and serious memory problems like Alzheimer's. So this seems to be like a little the slide is like missing like the top part. But so over time, the first question really is, how and why do we age? And, a lot of people kind of know what it is, but they really haven't, put their finger on it. But we age because over time, our cells in our body start to die. They just don't keep generating. And we, as a result of that, decline in many ways. And we'll get into that in a second. Also, we age because of environmental factors, and those have to do with lifestyle, diet, exposure to stress, and the environment. And many times people have gotten sicker in age just because of, pollution in the air and things like that, or being next to a place that, yes,
Aphasia and extreme dementia,
I'm sorry,
aphasia.
aphasia is not, it can be from as a result of dementia, but aphasia also, and for those who don't know what that means, it's the ability to talk or understand what people are saying. But aphasia can be as a result of a stroke or another physiological or neurological issue. Okay? So, this is part of why we have senior moments. So it's called the cognitive load theory. And it suggests that when the brain expends more energy on understanding speech due to hearing loss, it may have less capacity for cognitive functions. And I got hearing aids about 2 years ago. And you can notice I'm not wearing them. Yeah. And I'm not proud of that either, I have to tell you. But it's just like it's, I don't know if it's a male thing or what. But my wife goes, "Why aren't you wearing your hearing aids?" And I go, "Well, why do I want to hear what you have to tell me every day?" Just saying. So then she just smacks me in the head or something. So doesn't get, I don't get away with anything, I can tell you that. But hearing loss in many ways leads to more problems in just relating and communication, as well as you begin to, because you're missing things, you're beginning to cognitively not be as sharp. Okay. Okay. So I'm sure, I mean, you've heard these things a million times, but it's really important. So the main thing is staying active, having a good eating plan, I'm not necessarily saying diet, and exercise. The more you move, the better it is for you as we get older. Learning new skills is very important. And that can be word games, puzzles, card games, because it keeps your mind alert. Following a daily routine and what I call establishing a purpose, which is a reason to get out of bed. And every person that I ever talk with, there are many people who are lonely. I mean, they're still alert and oriented, but they're just lonely, okay? And they don't have a reason to get out of bed. Now, as a result of that, obviously, most of the time they become depressed. But on top of that, there've been studies done both in loneliness in nursing homes and loneliness in the community, and the highest rate of deaths, not due to some kind of physiological issue, is loneliness. I mean, people take it for granted, but and especially in today's world, our families have moved away. There's not the closeness with your neighborhood or your neighbors that you used to have. So there's not as many people looking after you just to make sure you're okay. And so you get up in the morning and you get out of bed and you're watching television all day long because you don't have anything else to do. And so I always try to stress with people, if I'm talking about retirement or if I'm talking about, a person's spouse passes away and they're mourning or grieving with death, they have to redefine or redefine their purpose. And sometimes that's not so easy. But you have to have a purpose in life. You have to have a reason to get out of bed. You know, all of you that are here right now, I'm sure you didn't flock here because of me, but I do think you wanted to learn something about the topic, and that's why you're here. And that's all involved in keeping yourself both active as well as keeping your mind more alert, because you're here to learn something new. And every day, people need to have a purpose. Some of you might have heard about this person or not. He was a neuropsychiatrist. His name was Viktor Frankl. And he wrote a book called Man's Search for Meaning. And it had to do with him, as well as his family, being in the concentration camp in Germany. And how did he psychologically get through that? And one of the things that he was able to do was to focus on, even though every day was just the worst thing possible, he was able to focus on what's he going to do when he gets out of here. And that was his purpose. And so that helps you endure whatever tragedy or tragic things that are going on in your life, because you lose that purpose. Caregivers, and I do a lot of training with caregivers because my company is called Caregiver Champion. Caregivers end up taking care of their own family, working full-time sometimes, taking care of a relative. And there's been a book that's called the 36-hour day. And actually is about someone whose mother had dementia. And for her, the caregiver, her life felt like it was 36 hours every day. And there is no ability to get some relief. And one of the things that I talk about is for caregiver training is you need to put on your, the saying on an when you're on an airplane, put your oxygen mask on first. You know, if you're dealing with people that are relying on you. And it's important, because what does that mean? It means that you need to take care of yourself before you can start to take care of somebody else. And part of taking care of yourself is the ability to define, yes, I know I have to take care of my mother, and I got to take care of my kids, and I got to shop, and I got to do this. But it's like, at a certain point, you're going to fall apart. The stress becomes overwhelming. And we're trying to prevent you from falling apart as much as we are trying to prevent whoever you're taking care of in those issues. So I help people start to define how to make their lives better and have a purpose. Now, obviously, taking care of your mother is a purpose. But when it becomes a strain that it's the only thing that's going on in your life, then that purpose loses the ability to help yourself. So I tell people, you know, what do you like to do? And I go, oh, what do you like to get your hair done? Yes. Okay. Well, then once a week, you need to get your hair done. And then from there, we sort of build into other things, but basically it's also learning to say no without guilt. You know, that's part of the purpose. But the purpose is saying, just as my family is, my mother is, and everybody else is, I'm an important person too. And I need to start to define my purpose in life for me. And there's nothing more critical than this. When you don't have a purpose, you really become much more depressed, much more anxious, and it overwhelms you to the point where you are gonna end up being very sick or depressed or whatever. So, going back to this, as you can see after the routine, make a to-do list. Mark things on calendars or notes. So if you have appointments, those are things that you want. Now, the to-do list can be good and it can be bad. It can be good because, you know, every day, here's the things I need to do. And it can be bad because sometimes you don't do all those things every day. And then you look at yourself and go, why didn't you do that? Why didn't you do that? So there's a sort of a self-criticism. But the giving the to-do list, again, gets you into developing a purpose. It doesn't have to be exact, but it gives you the idea that, you know, at 3 o'clock today, I'm going to do water aerobics or whatever the case may be. And then you do them. You do them. Hello.
We thought it was 10.
Come on in.
At 11.
Have a seat.
Yeah.
We're talking about forgetfulness and
Okay, we
Not-
forgot the time.
not to make a joke about this, but you forgot the time we started.
We didn't get it right in the beginning. That's
No, that's.
Welcome though. Appreciate it. The last thing is establishing a routine,
Yes.
like putting your keys in the same place every day. My wife has a smartwatch. I'm too dumb to use a smartwatch. But what she does with the smartwatch is she can push it and she can find her cell phone. So, but the point is, so I have to put my cell phone, put my keys and put my wallet in the same place all the time. Because otherwise I'm looking for it. Okay, so not only do I forget it going out the door, now I'm looking for it before I even get out the door. Okay. These are, again, things that are important in terms of forgetfulness. I don't have to really read them. I think the key here is that if you have suicidal thoughts, there is help for you. If you have high blood pressure, you need to learn how to control it. You need to limit your use of alcohol as well as, in today's world, marijuana or whatever other drugs you might be using. And you need to talk to a doctor or a counselor or therapist because it helps. It really helps. And, you know, being proudful and saying, well, you know, I'm depressed, but I'm not going to go talk to somebody about it. It's really hurting you much more than going to talk to somebody about it. It's that important. So now we're getting into what's dementia. And basically, dementia includes the loss of cognitive functioning, thinking, remembering, learning, and the behavioral abilities to the extent that it interferes with that person's quality of life or activities. These are the four main types of dementia. Alzheimer's, Lewy body, frontal lobe, and vascular dementia. Now, in reality, Alzheimer's, which lots of people call everything under the title of Alzheimer's, cannot be at this point diagnosed until that person has died and there's an autopsy. So now we've got a, yes,
Could you define those four things before you? I don't know, happen to know what vascular or frontal lobal does to
well,
you.
some of it has to do with the cause.
Has to do with what, did you say? It has to do with what?
So vascular dementia obviously has a lot to do with usually heart or circulation types of problems.
That white's covered, we can't get
Say it again.
that white strip. we can't see what
I,
they- Thank you.
This is where I get myself in trouble because we don't have to go backwards.
You just click on the slide itself. There you
There
go.
you go, you got it.
You're good.
Okay, so the four types were vascular dementia, Lewy body dementia.
What's that?
Lewy body dementia is very, it affects the part of the brain that actually not only do you have more difficulty retaining things. Hi, welcome.
Thank you.
But it makes you explode. So if I'm interacting with you, like you just asked the question, I would go, what do you mean you don't know this?
Okay.
And so it's very, very difficult to handle. And if I can get back to where I was.
You're still on the same slide.
Huh?
You're still on the same slide.
No, he meant the one.
The one before
I think he wants to go to the previous one. So
Wait.
I'm sorry. You sit here, you sit anywhere you like.
Well, if we're looking that way, I want to see.
I want to go back one. Okay,
Okay, I'll see.
so Lewy body is what I just mentioned about. Frontal lobe dementia usually is as a result of a stroke. All of these are affecting different parts of the brain.
Okay.
And what happens with dementia, now we talked about aging and what happens with aging. With dementia, your brain is affected in certain areas. So the frontal lobe is this part of your brain. And you were asking about aphasia or something. So that causes more aphasia as in this part of the brain. So all of these are just brain related, but it's what area that it affects. And what happens with people who have dementia, and you can start to get this, figure it out, because people get what's called an MRI, and a neurologist helps to define this. But that MRI then takes a look at your brain and it helps to understand what's being affected and whether you could do anything about it or not. Okay? And what happens with dementia is that there's what's called plaques that grow in your brain. PLAQES. GUS. They expand in your brain. And that's the start of going beyond forgetfulness and dementia. Okay. So this is sort of a chart that starts to indicate the difference. And item 1 is making a bad decision. The dementia phase is making poor decisions and judgments all of the time. Number 2 is missing a monthly payment, which is again forgetful. That and there it's problems taking care of monthly bills. And a good way to start to ask people about this is, how do you manage your checkbook? And, can you subtract whatever you're paying from whatever your balance is? Trouble having a conversation. So what happens is that, you've asked me questions. I hopefully have given you an answer that's, but if you ask me the same question and I start talking about, oh, I just saw a flag over there. It's sort of like, well, how did that connect with my question? And that's what happens, is that people bring up other things and there's just no way to connect with what's going on. Now there's what we call reality therapy. And reality therapy is, I want to go home and see my mother. Well, your mother passed away 10 years ago. And you say, there is no way my mother has passed away. Okay? And I was running a nursing home, and this woman came and was newly admitted, and she was in an activity, and she just like got up and was ready to leave. And she said, I'm going home to see my mother. And people tried to tell her, your mother's passed away. And she goes, well, if my mother passed away, why would I be here having a good time? Good point. So reality therapy does not work with someone who has dementia. And what we call this kind of therapy, and there's two people that are leaders in the field with this. One, her name is Teepa, T-E-E-P-A, Snow. And Teepa Snow has YouTube videos on different aspects of dementia and how you relate to people that have this dementia. And the other one she just passed away, actually. Is Naomi Fiel, F-I-E-L. You're shaking your head, see
Yeah,
that?
validation therapy.
Yes. And that's exactly what it is, because I was forgetting the name. Validation therapy. So for example, I'm going to go home and see my mother. Instead of arguing with that person about going and seeing your mother, you say, well, tell me what's your mother like? What does she do with you? And it gets the person concentrating on talking about the mother, but And that validates then the need or the urge to get beyond that. And I would suggest that, if you have further interest in this, that both of these people, you need to check out their YouTube videos. They're very, very effective and very good. And Naomi Phil, and I teach a lot of classes. And I've shown this, both of their videos through YouTube. Naomi Phil, she was raised in a nursing home. Her father was an administrator of a home in Cleveland. She does a video with a woman who literally is catatonic. She just doesn't move. She sits on a chair and that's the way she is, and she stares. Okay. So Naomi Phil goes up to her, and first she just starts stroking her cheek, just like this. And then she talks to her in a very calm and very nice way. And then she starts to sing, you got the whole world in your hand. Okay, and this woman starts tapping the beats. And by the end of the YouTube video, she is singing the words. It literally brings tears to my eyes every time I watch it. It's that dramatic.
How do you spell the last name of the word of the woman?
Feel?
F-I-E-L-D.
Yeah.
It's Phil. Thanks.
And you can look up validation therapy. Because that's what's important. So then, again, we talked about this before, and I'm a prime example of losing things from time to time, but we all are. But this one is like, you just never find it. It's gone. And I have a client right now that has dementia, and he's in a memory care facility. And he'll go, somebody took my wallet. And we go, nobody took your wallet. And I go, yes, somebody took my wallet, and I'm gonna find it. And they like go from person to person to person. Where is my wallet? Okay. So then these are things that also cause memory issues. And for the purpose of the people, do the people that are on Zoom, do they see the same slides?
Yes.
Oh, okay. So then I don't have to read them. But sometimes side effects from medication causes memory issues and can continue to affect you. And you don't even realize it. I mean, a lot of these other reasons are things that people typically have as we get older. But medications is very important. And that also is a reason for high risk of falls. You get drowsy, you don't know why. And so it's very important to know what medicine you're on and why you're on it, or your family member or something like that. And that's part of the reason why I have these cards, the medication cards, is because this is a way to keep yourself up to date But it also is a way when you go to the doctor, they ask you what your medicine is. And now what UPMC, I believe, has the continual medical record, so they can just go there. But for example, if you go to a doctor that's not a UPMC doctor and they put you on something else, that's not on your medical record. So having, here you go, sir. And there's more of them if you need them for other people. But having this and keeping it current is important because again, when we talked about how to be your own advocate, having your medication record, showing it to somebody or reviewing it with someone helps you to make sure that the side effects that you might be having aren't causing you to be more forgetful or hazy or whatever. Sleep, again, is another sort of red flag. You know, it's not necessary that you sleep 8 hours a day, but it is necessary that you sleep, I don't know, 5 or 6 hours a day, and that it's a good sleep. And good sleep means that you fall asleep, you're able to sleep through the night as you get up. Again, as we get older, especially men, we have to go to the bathroom. And somewhere in that time period. And when we go to the bathroom, there's been lots of times where I can't fall back to sleep. So I go to bed at 10:30, 11, and 2 o'clock in the morning, I'm trying to toss and turn and get back to sleep. And that's not a good sleep because then you're not as alert, you're not as bright, and cognitively you start to not be able to function. So there's like a million things now advertised on television. I take blah, blah, blah. And now my memory is just as good as it was when I was 20 years old. And they're happy and they're active and they're whatever. Well, I don't know if they work or not. But I can tell you that you really ought to, before running out and buying one of these pills, you need to be able to talk to your doctor about it. I'm not going to say that they might not help, but I'm basically going to say they don't always do what you hear on the advertisement. But they make a lot of money. So again, this is what becomes important. Leading a healthy lifestyle, controlling your blood pressure, being active, making healthy choices. Okay. So I passed out 2 tests, basically. One is called the Many Mental State Exam, MMSE. And the other one is called the Geriatric Activities of Daily Living Test. And I want you to take a look at the geriatric ones first. Because there are what's called ADLs, which are activities of daily living. And that's your ability to get up, get dressed, take a shower, shave, bathe, whatever, eat, take your medication, all of the things that we normally do during a day. And when we have a stroke or something else happens, we have a concussion, some of those activities of daily living become affected. But then the next level is called IADL. And the IADLs are instruments, activities of daily living. So that is doing a checkbook, following directions. So if I said to you, you know, the elevator is around the corner, so you need to go out the door, make a left, make a right, and the elevator will be in front of you. A lot of people can't follow those directions. And people who start to realize that they are having more cognitive issues, obviously, they are aware of the fact that they're not getting certain things like they used to. And they try to hide it. And that's very common with people. So this is a very basic questions about your ADLs. So you see toileting, feeding, dressing, grooming, ambulation, breathing, taking our own medicine. And clearly, we should be scoring, in the most part, you know, 4s and 4s, and possibly maybe a 3. But the idea is that as an independent functioning person, we ought to be able to do these things. So the next piece to this, which I did not pass out, is, and we'll get into it, but the many mental. So the many mental is, you probably have heard this or seen it, or maybe even have had it. But now we're starting to take things and mix them up a little bit. So, you know, some people will go, you know, what's the month? They're like, well, what is that? I don't know. And you go, well, what season are we in? And they'll go, oh, we're in winter. But it doesn't look like winter, so I don't know what the month is. What's today's day? Half the time, I don't know what today's day is. But again, it's not a measure of, oh, you got dementia, you don't know what today's date is. So then the questions become, you know, where do you live? What was your address? What's the name of the building? Da, 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 da. Then the next thing is, you name 3 objects. And then this is just an example. And so I will go chalkboard, door, and table. And then I'll keep talking. And maybe 10 minutes later, I'll say, now, what were the 3 words I gave you?
That's the test Trump got 100% on.
Sorry?
That's the test Donald Trump said he got 100% on.
Yeah, that's this one. Yeah. But nobody else could do this, you understand? That's as far as I'm saying.
Isn't it true, though, that, like, I've heard stories of scientists or professors that are very deeply into their area of expertise, and they don't know where they couldn't tell you their address, but that's not necessarily Alzheimer's. Is that true?
Oh, absolutely not. Again, their ability to do critical thinking, which is what we're talking about when we talk about Alzheimer's, is perfectly okay. And that's when I said about, you know, the article that I started with about the presidents. You know, yes, they get forgetful. Yes, we all get forgetful. But that doesn't make them not able to function in whatever role they are doing. Okay. So who can tell me the words that we just mentioned? Go ahead.
Board, chalkboard, table.
Say it.
Board, chalkboard, and table.
What order?
And table,
Chalkboard,
door, table.
right. You have to remember the order, okay? So now I asked you to spell the world, let's write the word world backwards.
L. R, W.
Good. Okay. But it's not as easy,
Not easy.
okay?
This is the tell.
And then and they don't have it on here, but I do this all the time. So I say, you know, what is this? And I'm not wearing a watch, but it'd be a watch. And then I say, draw a clock with the time that this is saying it is. And I don't know, probably it's around 11 o'clock or something like that. Huh? 11:30? Okay, so that's even better. So then I'm asking you to draw a clock with the time 11:30 on it. And I can tell you through my experience, and I'm not a psychologist or psychiatrist or neurologist, but I do this for screening. The people that have difficulty doing this clearly are, if they're not having dementia, they're on their way. First of all, they can't even draw a circle to draw the clock. And then they can't put the numbers around the circle so that you see what the clock is. And then finally, you can't put your, whatever these things are. What?
Hands.
Hands, right, at the right place around the clock. Thank you.
Yeah.
And that is it's really something that automatically I know this person's got some problems. And then I would suggest to them, you know, you need to go see a neurologist, you need to get some more tests. But it's important that they know how to both tell time as well as draw time. Okay? So then the next one is read the words and then do what it says. So it's sort of like Simon says. Simon says, put your hands on your head. Simon says, close your eyes. Simon says, shut up. But again, you're now starting to follow specific directions that you have to be able to do. And people who have early onset of dementia can't follow those directions. They just can't. And like I said before, if I told them to get down the hall and make a left and find the elevator, they couldn't do it. So the next thing is writing a complete sentence. And it doesn't be anything. But the sentence, you know, could be, you know, my birthday is in November. But now again, we're putting things together in some kind of logical order. And then finally is copying that design. Which is what are those called?
Pentagon.
Pentagon. Pentagon, right? I'm gonna take you home with this. Keep reminding
Follow
me.
you in.
Right, tell me what to worry more. My wife probably would appreciate it. So. Okay, so as we're starting to see here, what was normal forgetfulness now is becoming greater in terms of the abilities to function, the abilities to carry out certain activities, the abilities to do certain things. And I can tell you, initially, most people who start to realize this, they do try to hide it.
Sure.
And like, so for example, I say to them, what month are we in? Well, why is that important? You know, what do we care whether it's February, June, July? I don't care about that. You know, you go, what time is it? I don't care about what time it is. So they kind of avoid what it is that you want to talk about. And that in itself is a red flag. Okay? It's that important. Like the number 3 says, people that have mild cognitive disorder, they still can take care of their own activities of daily living. They're able to get dressed, they're able to function, they can get out of bed, they can walk very good in some instances. And you think, well, nothing's changed. I had a client who just called me. Her father-in-law has Parkinson's. And he walks 3-4 miles a day with Parkinson's, which is tremendous. He's able to get up, get dressed, and be independent in that fashion. But 2 months ago, he took a bottle of milk magnesia and drank it all. And I said, well, why did he do that? Well, because he was constipated and he felt like that's what he needed to do. So now we've got a red flag. And it wasn't because he was suicidal. It was because that's what he thought he needed to do in order to get himself not being constipated. And so my first suggestion was, you need to take him to a neurologist, get him tested, and see what's going on. So it might be, you know, just everything seems okay. But then certain things, symptoms or things that come up like that, and you realize you could shrug it off. Oh, that's just dad. Or you can say, wow, this is different. We got to do something about this. So we talked about this before. Losing things now, it's not just once in a while. All of these are more of what we've been talking about. Okay, these are resources. The Alzheimer's Society both has support groups here, as well as information that they put out. They're probably the most helpful. I have to tell you also, it's not on here, but AARP is an amazing resource for people. And they have many articles on forgetfulness and dementia. They also can talk about what you can do, things like that. The other thing that is the NIA, which is Alzheimer's and Related Dementia and Education. So that's the National Institute on Aging. And once again, I get sort of an update almost every week on something that they're involved with. So they'll talk about lots of things about resources as well as, what you can do, information, things like that. So, and the main thing, and may or may not help you to feel better, but you're not alone. Unfortunately, Alzheimer's or dementia, it's not that nobody has come up with why this happens, like they could make a drug and make it better. There are drugs that help people from not getting in as far as quickly, but it is something that you can't really remain the same. You just keep declining. And so I see there's a question there.
Please make the test available on VSA. It has been added.
Oh, okay.
What did you say? Can you repeat that?
It was,
Nothing?
they want the handouts
Oh,
and I have already added them, so.
Okay. I think that's it. This is where you can contact me. I passed out a brochure as well and my business card. Any questions, comments, any things you'd like to relate to the group? Well, I hope this was helpful. And I hope that all of you leave here realizing that probably what's going on with your aging process is pretty normal.
I have a 92-year-old lady, I gotta go back to her,
Yeah,
and I'm not sure if it's lazy, because when I open the door and do things, she's always yelling, what are you doing?
that was pretty.
But she came up, I said, what, she got her kicks on her feet. And I said, to her, why are you doing that? Oh, well, my life's better than yours. So you make yourself feel better, somebody else is hurt.
you never know what people do.
I know. It's
Never
amazing.
know.
So that's why I'm here. I'm here to figure out why she does the things she does. 'Cause she knows her name, she knows her birthday,
That's
she
right.
knows her address.
Those are good shoes.
She just does, just like you said, she just doesn't care.
That's a good. I have them too.
Didn't see the time on the paper.
Thank you all for coming.
Oh,
Thank you.
Next topic is 25 document